Hi, this is Dr. Mercado here at Orange States Dental. I'm a dentist down in California. I want to spend a few minutes going over emergency dentistry or emergency dentist. I get a lot of questions about what is an emergency in dentistry and when should you see a dentist versus, say, go to the emergency room. So I want to spend a few minutes answering some questions, some of the common questions I get, and hopefully better improve your understanding of the topic. So a dental emergency is pretty much anything that will be, in this case, for most patient hurts. So if something's hurting right now, that would be an example of a dental emergency that you would need to see a dentist pretty soon, right? Things also like swelling, things breaking in your mouth, say if you have some working in your mouth, they have different things called bridges, fillings, crowns, different things that in your mouth that can break, things that maybe not hurting you right now, especially that's a big one that I see where patients kind of don't think of it as an emergency. When something's broken in your mouth, that's a very bad sign. So that's one also example where it would be an emergency in dentistry. Bigger things too would be the swelling, any swelling around your neck, especially your face, that'd be definitely something to see, be an emergency. And you want to see a dentist for that. So in the perfect world, we schedule appointments every 6 months and we get seen by a dentist. But life's busy, so I get that. We can't always do that. But in terms of seeing an emergency dentist versus seeing an emergency room, a couple of situations there. For the most part, most dental emergencies can be handled by a dental office. Essentially, when you see an emergency room for a dental problem or dental emergency, they tend to give you some medicine, tell you to go see a dentist for the most part. But essentially, if you do have an emergency happening in your mouth, the dentist you want to see is one that handles emergencies, right? Other than really one thing, in my experience, if you have swelling around your neck, most of the time, if you come see me, I can help you with it, but I'm probably going to refer you to an emergency room. That's actually life-threatening at that point, or it could be life-threatening. If you have swelling around your throat, it can turn into swelling in your actual breathing tube here, your esophagus, your windpipe, and then you actually can't breathe. So that's a very bad thing. But everything else, swelling, say, of your cheeks, tooth pain, toothache, broken things, broken teeth in your mouth, for the most part, that can be handled by an emergency dentist. So that's kind of the good thing with it. So some of the most common types of dental emergencies are broken things in your mouth. I know for some patients, and a lot of patients, it's pain. So I should probably bring that up. Pain tends to be the number one thing that patients come into me and we see them on an emergency basis. But for the most part, every little thing in your mouth, so bleeding gums, actual tooth pain, broken parts, so broken teeth, broken fillings, broken bridges, broken dental work in your mouth would also be an emergency. A lot of times I see the patients when it's pain, and that's kind of the end of the road. I can't really do much except actually take things out. In this case, we talk about taking teeth out, right? For the most part, any dental emergency can be handled in our office and most dental offices. The idea here is we see you before it turns into a big deal or a bigger deal that we can handle, right? Now, as far as things happening, dental emergencies, most things can be handled the same day. So in this case, at least get you comfortable, make you feel better, give you some medicine, et cetera, make things go a little smoother, right? Before they get even worse, right? But for the most part, those are the things that are dental emergencies, and that's how they're handled. So anything broken, pain, bleeding gums, definitely something that you would maybe not always think of something as a dental emergency, but you definitely want to seek help for that. So an emergency dental extraction happens when we're at the end of the road. So there's no real hope or helping a tooth that has to come out, right? Every once in a while, we'll run into a situation where your tooth is bad enough where it's like life-threatening, and that tooth has to come out ASAP. It can't, be a week or another month or, next year or something like that. That's kind of what it comes down to. Unfortunately, a lot of those things can only be found when you go see the dentist and they look at your tooth, look in your mouth, take an x-ray. So those situations that can be life-threatening and you have to need an emergency extraction at that point, right? Other things that, freaks people out, broken things in their mouths, those things, I won't say they're not emergency, they are, but they're less, dangerous in that sense. So a lot of times when something's broken, I'm not saying hold off with it and wait forever, but the idea here is that if you take care of an emergency before it becomes an emergency, it kind of helps out that way a lot. So one thing that we talk about with emergency dentistry or emergency dentist is root canals. The root canals advance a lot, so we can do them without having pain and all that stuff. But the idea here, when you need a root canal, you have a tooth I'll call this word, we have a hot tooth, and the patient comes in pain. You can begin having pain with hot, with cold, biting, with chewing, all of that. But emergency root canal will be done when the tooth is still savable. So we're not to the point where you need an extraction or have to be removed from your mouth. In this case, a tooth, right? The tooth gets to be saved, and that's when the emergency root canal is done. Usually the emergency root canal is not completed the same day, just so you heads up. A lot of times the root canal started when it's sort of an emergency. It started, and then you're given some medicine, and then when you come back, we were to finish the root canal. We don't want to get, the problem, which is usually the infection or bacteria stuck or left in your tooth. We want the root canal to kind of get started, and then, you feel better, and then we finish it off. Usually that's how it goes. So one thing is big for patients, especially in emergencies, you want to be seen at the same time. And we do offer here in our office, we offer same day care. And most offices will. Most, if you're in pain, most people want to help, whether it's a dental office or, any other business, right? But for the most part, we want to be able to help you the same day when we can, for the most part. One big deal, though, is what we do, like, say, every 6 months appointments, some of the emergency appointments go away for you. And now we tell patients, for the most part, those evening appointments, those weekend appointments are the most popular for most patients. And those are the hardest to get when you're having an emergency. Right? That's a big one there to remember. Keep in mind, life's busy. I get it. Things are running at us a million miles an hour. But the best thing we can do is handle things before they become a big problem with those 6-month checkups. So definitely our office offers late evening or I would say later evening appointments. So definitely they can be scheduled in an emergency situation. But those also tend to be the most popular ones for most patients, right? The idea here is that we see you before that happens. But if it does happen, we're here in the evening, right? I'm also available late night. We have an emergency or call service after hours. So if it's a real deal, like, things are going bad, I had to pull this trigger very often. I'm not opposed to coming in late at night if the patients really need, because again, if it's serious enough, if I get information about it, I definitely want to help. And if it's something real big, real serious emergency where it's be life-threatening, we don't want to wait till the next day or next week or something like that. So definitely. Weekend appointments are an option, right? The idea here is that it's planned ahead of time before we're running into a major emergency. Now we're talking about emergency dentistry. So I get it, if life is busy, so we didn't work it out that way. But yeah, definitely most dental offices can see you on the weekends. So I hope that was helpful going over emergency dentistry and emergency dentist. If you have any questions or you need take actions, hopefully you're watching this and you're not in pain or anything like that, but give us a call. It's 562-659-7246. We're here to help. Thank you.